you first want to check with your insurance or your payer and make sure that they cover that screening for colonoscopy at the age group that you're in, whether you're at risk, determines those factors, or if you, like you said, if you are 45 or over, you should be eligible based on the Affordable Care Act.
Hello and welcome to the HiFi Health News Podcast. I'm Erika Grotto. We have a 2-for-1 episode for you today. First up, it's tax time. So if you don't like what you're seeing on those returns, we have some advice about a health benefit that could help you for next year. Second, March is Colorectal Cancer Awareness Month, so we're going to be talking about everyone's favorite screening, the colonoscopy. Recently, I talked with Shawn Stack, a policy director at the Healthcare Financial Management Association, about both of these topics. We'll jump right in with taxes and 2 types of accounts that allow you to save money for your healthcare expenses. One is the Health Savings Account, or HSA. The other is the Flexible Spending Account, or FSA. Both allow you to set aside money pre-tax, but there are some key differences you should know.
Health savings accounts, Erika, from a tax perspective, for HSAs, contributions are tax deductible or pre-tax if made through payroll deductions, and earnings grow tax-free if you invest those earnings. Withdrawals are for qualified medical expenses, and those as well are tax-free. Under FSAs, flexible spending accounts, contributions are pre-tax, and they reduce that taxable income and save money on payroll taxes. So there's kind of more benefits under an HSA. They call those triple tax advantages than under FSAs, if that makes sense. And then also flexible spending accounts cannot be rolled from year to year and do not transport with the employee, but HSAs do. So if you don't use up all the money that you've gathered in your health savings account at the end of the year, that rolls over continually. And if you leave your employer and go to another one, that HSA moves with you. Flexible spending accounts, you don't have that luxury.
So what can you use these things for?
They can be used for medical, dental, vision expenses, including copays, deductibles, prescriptions, and over-the-counter items.
How much money do you want to be putting into one of these things? Or maybe a better question is, how do you decide how much to put in?
So a great deal of folks who contribute to HSAs typically try to max out their benefits if they can afford to do so, because that is a pre-tax, tax-deductible way of saving money, since those funds continue to roll over and you don't lose those at the end of the year. But flexible spending accounts, FSAs, require a little bit more budgeting, because if you don't use that in that year, you lose that money that you've invested into that fund. So you don't want to overstate your contribution for an FSA, because that money is gone at the end of that benefit period.
Obviously, if you don't currently have an HSA or an FSA, they can't help you on this year's taxes, but it's never too early to start planning for next year. Next up, your free colonoscopy may end up costing you. If you're over the age of 45, chances are your doctor has recommended a colonoscopy. That's a screening test for colon cancer, and under the Affordable Care Act, it's free for most people. But Shawn Stack, a policy director with the Healthcare Financial Management Association, told me it could end up costing you anyway.
Well, Erika, lots of factors go into the cost sharing for colonoscopies. You first want to check with your insurance or your payer and make sure that they cover that screening for colonoscopy at the age group that you're in, whether you're at risk, determines those factors, or if you, like you said, if you are 45 or over, you should be eligible based on the Affordable Care Act for a screening colonoscopy. But that screening can turn into a diagnostic colonoscopy if indeed polyps are found and removed during that procedure. So you want to make sure you ask your payer, your insurer, what their coverages are and what that cost sharing amount is. you also want to ask your payer and make sure that your provider knows which professionals and which clinicians are going to be performing that procedure, because based on the gastroenterologist, the facility, the anesthesiologist, and the pathology lab, if any of those are out of network, you could have out of network cost sharing.
So when you go from a screening to a diagnostic, you're actually under anesthesia. So it's not practical for them to ask you in the midst of this about cost. What actions can you take ahead of time to ensure that you know what you're in for before you wake up after and it's all done?
Yeah, that's going to be based on your benefit design with your payer. And that's a conversation that you'll want to have with your insurer to make sure that you're aware of any upfront cost if that colonoscopy screening turns into a diagnostic procedure during that point of review when you're under anesthesia.
The colonoscopy is pretty well known for its preparation process, famous for being unpleasant. And something that surprised me was that the prescription laxative that you need to do that preparation process isn't always covered, but the process itself is. Are there other things that might surprise people that aren't covered for the screening or diagnostic test?
Yeah, it's depending on your clinician and, of course, your medical needs. You're right. That prep work could be fairly simple and expensive, or depending on what your clinician has ordered, it might not be covered if it's a prescription. If it's prescription medication that you're taking for that prep work, there are over-the-counter preps that can be, acquired that are very affordable. So that is something that you want to ask your clinician up front. What are my options here for prep, and what will that cost be?
If the costs or the prep are making you rethink that colonoscopy, there could be some alternatives available, so definitely ask your doctor about that. That's all for us this week. I'm Erika Grotto for HiFi Health News. Thanks for watching.